Good evening. My name is Martin Luther Negu Wake Up. I am a student practical nurse, and the video is about oral medication administration and then with sublingual and buccal medication teaching. So, for this purpose, we're using the bed rotation number 2. I will start with my medication check first. So, for this, I have the medication administration record, and I also have the doctor's order here, and I have my medication pre-prepared already that I took from the pharmacist. So before that, I'm gonna start with by checking. So I have 3 checks and do the 5 medication, the 5 rights. So I, I will start by checking the doctor's order with the medical administration record. So the patient name is Stevenson Rogers. Stevenson Rogers, February 2nd, 1950. February 2nd, 1950. And I also see that it's the medication, the doctor's order calls for Citricol 250 milligram, 2 tablets twice a day, PO, so oral medication. And on the medication administration record is Citricol 250 milligram, 2 tablet twice a day, PO, so oral medication at 0800 and at 1700. I will now I will just put away the doctor's note, and I will just go by. I'll now compare the medical administration record with the MA with what I have here. So I will the the right. I have the right patient. His name is Stevenson Rogers. So that's the first check. Date of birth February 2nd, 1950. Stevenson Rogers, February 2nd, 1950. The right medication, it's the Citricol 250 milligram. Citricol 250 milligram. The right dose, it's 2 tablets, 2 tablets twice a day. So 2 tablets twice a day. Um, the right route, it's a per oral, which is oral medication, and to administer at 0800 and at 1700. I also check the expiry date, which is January 31st, 2022, which is good. That's my first check. The second check I put in my palm, and I check again. Stevenson Rogers, February 2nd, 1950. Stevenson Rogers, February 2nd, 1950. That's the right patient. The right medication is the Citricol 250 milligram. Citricol 250 milligram. The right route, it's per oral, which is oral medication. The right dose is 2 tablets, and then the right time is twice a day, which is 0800 and at 0800 and at 1700. So that's my 5. That's the second check. The third check, I will put that on my tray, medication tray, getting ready to go see the patient. um, Again, I check for the third time. So Stevenson Rogers, February 2nd, 1950. Stevenson Rogers, February 2nd, 1950. Citricol, that's the right patient. The right medication is Citricol 250 milligram. Citricol 250 milligram. The right dose, which is 2 tablets. The right time is twice a day written there. So the right route, it's a PO, per oral. So oral medication. So that's are my 5 rights. So now I'm gonna move to go see my patient and administer the, 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 the medication. And yeah, we'll put. Mhm. So now I came to see my patient. I will again start with hygiene. Come.
Yes,
How are you today?
Yeah.
My name is Martin, and I'm a student practical nurse. I came to administer the to give you your medication according to the doctor's order. So the doctor ordered Citrical 250 milligram, so 2 tablets twice a day. So that's what you will be taking. What's your name, please?
Stevenson Rogers.
And what's your date of birth?
February 2nd, 1950.
1950. I'll check that with the two identifier on your wrist. Good. They are matching. Um, do you have any allergy?
Yeah.
Okay. Do you know the well I just explained told you the reason why you're taking that medication. You were feeling you had a little bit of weak bones and that it's basically like a calcium, so it will strengthen your bone and it will help you also with like those condition caused by the lack of calcium. So that will they will help you. Okay. You might have some side effect when you take it. So constipation, it might be stomach upset. So just let me know. In case you have things like shortness of breath or rashes, or just alert us right away. You have the alert button. You can press that. And as you know, you have the right to refuse the medication. I would just have to 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 mention the reason why. Now we will just proceed by I will administer the medication. I have a glass of water that you can take, and then you take the medication, and then you can. So you don't have any problem swallowing, right? So. Mhm. And you have no known allergies, so that's good. Um, I will take the glass of water from you. We will dispose that, and then yeah, we'll perform hand hygiene again. Done. And then at the end of once we administer medication, we have to write to do the right documentation. So with the documentation, we have to fill up the medical administration record right away. We should not delay with filling the medication. We should not fill we're filling the MAR, and we should not fill the MAR before we administer the drug. So, and with the right evaluation is will be clearly to see if the patient's condition has changed. In case of Mr. Stevenson Rogers, for example, his vital sign were slightly, he had a slightly higher blood pressure that came back to 125 to 85, which is within the normal range. His oxygen saturation, but that also improved. I think he was at 97% after taking all the medications. And I believe also that his respiratory detail was better. I think he had 20 respiration per minute. Now he's back to 18, which is within the normal range, 12 to 20. So yeah, that's conclude the video. But before that, we have some teaching to do. So the difference between a sublingual, a buccal medication and an oral medication. The sublingual is a medication that we take right under the tongue. So we have to let the medication dissolve completely without using any liquid, and it dissolves and goes right into the system into because there are lots of blood vessels in our mouth, and so that's the goal. If we should not take any liquid. If the patient take any liquid, um the medication won't have the effect that it's supposed to have. Buccal medication is a medication that we put on the mucous membrane of the cheek or the gum, and it's also also has to dissolve completely. if we let it, if we should not drink any liquid. Whereas the in case of the oral medication, you can take it with a liquid of your choice. It could be water, provided those liquids are, compatible with the drug that you're taking. Um, yeah, so that's what in regards to the teaching of sublingual medication, buccal medication. Thank you.